Watch how this doctor applies Lavior on a diabetic patient.
If you're at home, you can get normal saline from the pharmacy and you can use to wash the wound. Once the wound has been washed, you're gonna apply this plant-based Lavior Hydrogel. This is a diabetic wound gel right on the surface of the wound. And if you have excess, don't worry. You can take the excess, you can put it on your normal skin because it's great for eczema. It's good for inflammation and helps to soothe and hydrate the skin. Okay, so this product, this Lavior Hydrogel, is a supercharged hydrogel indicated for diabetic foot ulcers, for minor cuts and scrapes, for venous ulcers, for burn wounds, and for traumatic wounds as well. So once applying it on, you can either put like a box-like dressing like this. In this particular case, this wound is really not draining all that much, so you don't need to pad it up too much. So you can do this to secure it. So we're just going to secure this. So again, this particular ulcer is almost healed. It's not draining all that much. And so we're just going to secure it. Different types of tapes out there you can use. So you can have a choice of doing like a boxed dressing like this with this, or you can put some gauze and you can secure it with bandaging like this. Okay, if you feel like you want something that is a little bit more secure, and make sure it does not move, so you can do that as well. Okay, just to better pad it. And this is to be changed every 2 days and kept clean. Okay, so for patients who want to change the dressings at home, let's say if you decide you want to change it every day because you don't feel comfortable, you have to be very careful that you take care of the wound separately from the rest of your body. So in other words, cover with a plastic bag, shower, don't get it wet, and then sit down and then take care of the local area by washing the wound with normal saline or whatever wound wash solution that you pick up from the pharmacy. Go ahead and get the Lavior Hydrogel, apply it on a non-adherent type of dressing. Place it directly on the wound. This particular dressing is a non-stick, and then apply your Band-Aid. The hydrogel will allow the wound to heal with minimum scarring, helps reduce inflammation around the wound, and it will help the wound heal in pretty much a normal progressive healing time. It also prevents it from getting infection. With the Lavior Hydrogel, when you apply it directly on the wound, it kills any bacteria on the wound on contact. So within 60 seconds, any type of infection that you have locally on the surface of the wound, it will help manage that.